It's a move sending shockwaves through the global pharmaceutical industry. Donald Trump proposing a 200% tariff on imported medicines.
Pharmaceuticals will be tariffed probably at the end of the month.
Well, things have taken quite a turn in international politics, and once again, former President Donald Trump finds himself in the center of a global storm. This time, it's not about immigration, trade wars, or Twitter rants. It's about medicine. Life-saving drugs, to be exact. And it all started when Trump, during a fiery rally, announced what he called a bold step to protect American pharmaceutical interests, a 200% tariff on all imported drugs from countries he claims are freeloading off the U.S. innovation machine. Yes, you heard that right. A 200% tariff on imported drugs. Trump claimed that for too long, nations like Canada and Australia have been paying a fraction of what Americans pay for the same prescription drugs, sometimes manufactured by the very same companies. He framed it as unfair, un-American, and absolutely unacceptable. In typical Trump fashion, he didn't mince words. He called it robbery. He called it betrayal by American pharmaceutical companies. And he warned that the United States would no longer be the piggy bank for the world's healthcare systems. The reaction from the international community? Swift and loud. Canada responded first. Prime Minister Trudeau held a press conference in Ottawa where he rejected the tariff as completely unjustified and harmful to patients on both sides of the border. He emphasized that Canada will not be bullied into paying inflated prices simply to satisfy American political ambitions. Trudeau also noted that Canadian pharmaceutical importers had already begun seeking alternative trade arrangements with the EU and other partners to avoid disruption in supply chains. But it was Australia's response that really drew global attention. In a speech to Parliament, Prime Minister Anthony Albanese was visibly frustrated. He declared that Australia will not dance to the tune of protectionist policies coming from Washington. He reminded the world that Australia, like Canada, negotiates drug prices based on public health needs, not corporate profits. The Australian government went one step further. They threatened to impose reciprocal tariffs on American medical devices and technology if Trump's proposal became official U.S. policy. So here we are, a standoff. Two of America's closest allies, both longtime military, economic, and diplomatic partners, are pushing back hard against what they see as a hostile act. And Trump? Well, as expected, he's doubling down. In several interviews and Truth Social posts, he's blasted Trudeau and Albanese, calling them weak globalists, pharma puppets, and accusing them of waging economic war on the American worker. He even went so far as to say that if they don't get in line, the U.S. should consider restricting access to American-made pharmaceuticals altogether, essentially cutting them off. That comment alone sent shockwaves through the medical community. Doctors and health experts in the U.S. and abroad immediately raised concerns about the impact of such a move. Imagine this: vital medications for cancer, diabetes, mental health, and rare diseases being delayed or denied over a trade dispute. Not only would that put lives at risk, but it would also set a dangerous precedent, weaponizing healthcare in the name of political theater. And let's talk about the numbers. Canada imports roughly $4 billion worth of American pharmaceuticals each year. Australia's number is smaller but still significant. A 200% tariff would raise costs dramatically, forcing governments to either absorb the price hike, pass it on to consumers, or seek alternatives from European and Asian suppliers. In the short term, this could mean shortages, delays in access, or disruptions in care. In the United States, the move is also raising eyebrows, even among Trump's own party. Several Republican senators have expressed concern, privately and publicly, that such a tariff could backfire. They argue that it could isolate the U.S. even further on the world stage and hurt the very pharmaceutical companies that Trump claims he's trying to protect. After all, many of these companies rely on global sales to fund their research and development. Creating barriers could reduce their revenues and, paradoxically, limit innovation. Democrats, predictably, are outraged. Senator Bernie Sanders called the idea morally repugnant, saying that medicine should never be used as a bargaining chip in trade wars. Others echoed the sentiment, warning that the move could worsen America's already fragile standing in global health diplomacy, especially in the post-pandemic world. So, what's really going on here? Is this about fairness? About protecting American innovation? Or is it just another Trump headline designed to rally his base with the promise of America first, no matter the consequences? It's hard to say for sure, but one thing is clear. Trump is tapping into a long-standing frustration many Americans have about prescription drug prices. It's no secret that Americans pay some of the highest prices for medication in the world. The same insulin that costs $30 in Canada can cost over $300 in the US. Trump knows this, and he's using it to fuel his narrative. But instead of going after Big Pharma or pushing for domestic reform, he's pointing fingers outward, at allies no less. And while the headlines might read, "Trump goes mad," this move is calculated, it's emotional, it's dramatic, and that's exactly how Trump operates. He creates conflict where others seek compromise. He turns allies into opponents, then blames them for not falling in line. It's a playbook we've seen before, whether it's NATO funding, trade with China, or the Paris Climate Agreement. But this time, the stakes feel even higher, because it's not just about steel or oil or military spending. It's about health, about medicine, about people's lives. For millions of Canadians and Australians, access to affordable medication is not a luxury, it's a necessity. And for Americans who hope for lower drug prices, this kind of rhetoric might sound promising at first, but the long-term effects could be devastating. Isolation, retaliation, and uncertainty in the global health supply chain. In the coming weeks, international trade bodies like the World Trade Organization may get involved. Lawsuits could be filed. Emergency meetings may be called. Diplomats will scramble behind closed doors to avoid a full-blown crisis. But the tension is already there. The lines have been drawn. And once again, the world finds itself reacting to the unpredictable whirlwind that is Donald J. Trump. So, what happens next? Will cooler heads prevail, or will this spiral into a larger confrontation? Will American pharmaceutical companies step in to stop it, fearing revenue loss? Will voters rally behind this tough-on-trade stance, or will they reject it as reckless? Only time will tell. But one thing's for certain. Trump may be out of the White House, but his ability to shake the foundations of global diplomacy remains very much intact. And if you think this story ends here, think again, because as we've seen over the years, when Trump makes noise, the world listens. Whether it agrees or not, the echo of his decisions always lingers long after the press conferences are over. Thanks for watching and subscribe my YouTube channel.